The following will be a review of the new sudden cardiac arrest law, often referred to as Daysha's Law. On July 24, 2025, Governor Hochul signed Daysha's Law. This law requires schools adopt a cardiac emergency response plan. This legislation amends several sections of education law, including Section 917, which mandates that school districts have automated external defibrillators, AEDs, on site. The law now requires that AEDs be clearly marked, accessible, and maintained consistent with guidelines set forth by the American Heart Association or other nationally recognized guidelines. What is cardiac arrest? A sudden, sometimes temporary cessation of function of the heart. Cardiac arrest can occur for a variety of reasons, such as heart attacks, drownings, trauma, or choking. Basically, a heart starved of oxygen-rich blood will cause cardiac arrest. As a result, the heart will stop beating or an abnormal heartbeat will occur, which is not capable of providing proper blood flow. It is important to understand the difference between a heart attack and cardiac arrest. Sometimes these terms are used interchangeably, but there is a big difference. A heart attack is caused by a blockage in a coronary artery. The person experiences chest pain, heavy, or tightness in their chest, shortness of breath, pain in the left arm and or back, sweaty and pale skin, nausea, and a heart attack can lead to cardiac arrest. A person having a heart attack is typically conscious. Cardiac arrest is the immediate loss of consciousness. Irregular gasps for air may occur immediately afterwards. You may see seizure-like activity. They're not breathing, they're not moving, no pulse. The individual may turn pale or blue. CPR and AED are needed immediately. During a heart attack, a blocked coronary artery will cause heart muscles to become damaged and possibly die. Damaged heart muscles can cause the heart to beat improperly or stop, resulting in cardiac arrest. A person experiencing these symptoms should be kept calm and comfortable. Call 911 and observe the individual for signs of cardiac arrest. Recognizing cardiac arrest. A person may unexpectedly collapse and not respond to voice or physical stimulation. Seizure activity may occur. Agonal breathing or irregular gasps may occur. No obvious chest rise or breathing or movement is visible. Recognizing these signs immediately, calling 911, start CPR, and retrieve an AED are necessary. What is CPR? CPR is the physical act of pushing hard and fast on an individual's chest whose heart has stopped beating properly or is stopped altogether. CPR also involves providing artificial ventilations through mouth-to-mouth or utilizing a physical barrier. During CPR, you're pushing the chest up and down, allowing the heart to pump blood through the rest of the body. This keeps the blood flowing to the vital organs. CPR essentially buys time until an AED can be utilized on the victim. Immediate CPR is important because for every minute a cardiac arrest victim goes without it, their chance of survival drops by roughly 10%. After 10 minutes without blood circulating throughout the body, your chance of survival is nearly zero. Immediate CPR and AED can double or even triple a person's chance of survival. It is important to know where AEDs are located in and around your building. The chance of survival from a sudden cardiac arrest event is dramatically increased when an AED is properly used in conjunction with CPR. As a staff member, please be aware of where AEDs are located and consider taking a CPR AED course if available.